All right, good afternoon, everyone. Happy Saturday, and thank you for joining us during this virtual CurePSP family conference. This afternoon, we will be continuing with a patient perspective panel. Our panelists will entertain pre-submitted questions and discussion related to the journey as a newly diagnosed patient, a clinical trial participant, and other aspects of care related to PSP and other prime of life disorders. My name is Bobby Hand. I'm a licensed physical therapist currently serving as Movement Disorders Program Coordinator at Virginia Commonwealth University's Parkinson's and Disorders Center here in Richmond, Virginia. I will be moderating and leading this panel this afternoon. In addition to this clinical position that I hold, my interests are focused primarily on improving quality of life for families affected by movement disorder diagnoses. And I am also honored to serve on the CurePSP Board of Directors and an active participant in the CurePSP Patient and Care Partner Advocacy Committee. I'm joined this afternoon by Dr. Mathew Barrett, also of the VCU Parkinson's and Movement Disorders Center. Dr. Barrett is a movement disorders neurologist specializing in treating conditions with overlapping movement disorders and cognitive disorders, such as progressive supranuclear palsy, Parkinson's disease, dementia with Lewy bodies, and Huntington's disease. He serves as director of our CurePSP Center of Care. Following his neurology residency at the University of Virginia, Dr. Barrett completed a fellowship in movement disorders at Beth Israel Medical Center in New York City. During his fellowship, he earned a Master's of Science in Clinical Research Methods from Albert Einstein College of Medicine. Thank you for joining us, Dr. Barrett. It is now my pleasure to introduce our patient perspective panelists. With us today, we have Diane Deaver and her husband, Doug, who live near Santa Cruz, California. They have two daughters with families in Mexico City and Anchorage. Diane was a nursery school teacher, and some of her hobbies and interests include quilting, biking, and writing. She describes stability issues which started 2 years ago, and she was diagnosed with PSP about 1 year ago. She is currently involved in a stage 1 clinical trial at UC San Francisco. Finally, we are joined by Marty and Wanda Reimstead from Amory, Wisconsin. Marty is a retired physician, and Wanda is a retired high school French teacher. They have 2 daughters, 3 sons, and 1 grandson. Marty's wrapping up this week's birthday celebrations by joining us today. So thank you to all of our panelists. I'm going to start by reading some of these pre-screened questions that were submitted to us prior to registration. Dr. Barrett, I'm going to start with you first. I have a few questions here specific to your role as a movement disorders neurologist for this patient population. What are the most promising approaches for slowing progression of PSP?
I think it's a really exciting time for PSP because there are a lot of different strategies and treatments currently in development. With all neurodegenerative diseases, there tends to be some protein that accumulates in the brain, and in PSP, that's tau, or abnormal forms of tau that tend to accumulate. And there are a lot of different ways that people are developing to either clear out that abnormal tau or even prevent it from forming in the first place. So tau in its normal form is important for neuronal function and stabilizing. Normal tau is one strategy people are using to try to slow the progression or even prevent any worsening. Another strategy is to limit the conversion of tau from harmless forms to these forms that tend to aggregate and are toxic to neurons. And then the third strategy, but not the only, is to clear out the abnormal tau. Using the own body's immune system is one strategy people have used. So I think why I'm so excited is that there's not just one approach being used. We think we understand that abnormal tau is really critical to to PSP and its progression. And there are lots of different strategies being devised to deal with that problem.
Thank you. The next question I involves prognosis. So could you please explain a bit about what is the prognosis after diagnosis?
So the median survival that's published is 6 to 9 years, and I think a lot can be lost in that number because that's the median, and half of people live longer, and there are some pretty significant outliers. And I've met some of them myself in my clinic. And then on the other hand, there are some individuals that have a pretty rapidly progressive course. So there's just a lot of individual variability, and I think that's the most important thing to recognize early on. The course that any individual takes is probably best predicted by how they've done so far. So, that is not clear up front, but after a few years, the rate of progression or change someone has had is probably likely to continue at that same rate. One important point I always like to make when talking about this is that if someone's PSP seems to be changing rapidly or speeding up, there's probably something else going on, either another medical issue or maybe even another neurological issue. So it's good to touch base with your neurologist or even primary care doctor if things seem to be changing rapidly. And I think importantly, the other thing is that, yes, the disease changes. That rate is not entirely clear, but there are lots of ways to build up compensatory mechanisms to deal with the symptoms and reduce their impact.
Great, thank you. I think that's really important for all of us to recognize that we're in this together, but every patient and family is walking their own unique journey. Thank you for that. Now, more specific to some of your clinical specialty, I saw a question here. What treatments are available for cognitive and mood disorders?
So like a lot of symptoms in PSP, and I guess the motor symptoms are what always come to mind, we don't have a lot of great medical therapies. So by that I mean medications or surgical treatments. And that's the same for cognition. So I think what we can focus on is improving the things that might be negatively impacting cognition, like sleep and mood. So there are some specific ways to deal with sleep or improve sleep quality, hopefully, that might improve cognition. And then if someone has depression or anxiety, there are certainly ways to treat that with the medicines that are used. Common antidepressants can be quite useful. And that in itself can improve cognition if that's what's actually impacting someone. As far as other psychiatric symptoms or mood-related symptoms, irritability is a fairly commonly encountered symptom at times, and antidepressants can be useful for helping to manage that. And then lastly, agitation is another symptom that might occur, and there can be a role for medications in the antipsychotic class sometimes for that symptom. So no treatment. It's not one-to-one. So, one medicine that might be good for depression in one patient may not be in another patient. So it definitely can take some trial and error. I think a lot of neurologists in my position have experience with many of these medicines, but sometimes getting a psychiatrist involved can be useful as well.
Great, thank you. Now, maybe building up on the piece about cognitive and mood symptoms, we recognize sleep is so important to these functions, and patients with PSP and other prime of life conditions may struggle with insomnia. Do you have any suggestions to improve insomnia?
Sure. So insomnia is very common in PSP. And I think the first thing to always focus on is whether there are some changes in behavior or the environment that might be helpful. They're the things that have the lowest side effects of what we might try. So these recommendations can all fall under the category of things that improve sleep hygiene. And if you search that on the internet, you can find lists given out by the NIH about how to improve sleep hygiene. So I'll just highlight a few of those recommendations. One is to avoid alcohol and caffeine, especially caffeine, especially after 2 o'clock or even earlier if someone's sensitive to it. Cutting fluid intake in the early evening to avoid multiple trips to the bathroom. You want to be mindful of dehydration, but certainly there can be a time where if someone stays well hydrated during the day, they can stop drinking in the evening to try to avoid those trips to the bathroom. And then I think it's always good to emphasize that exercise itself can improve sleep quality, so that can play a role. And limiting naps, avoiding screens, in the hour or even more than that prior to bedtime, and then making sure the bedroom is dark, quiet, and cool. So I've highlighted just a few of what can be a pretty long list. I have to say, even myself, when I see any of these specific recommendations, I wonder how much they can really be effective. And I think each of them don't have a huge effect, but when you really focus on all of those recommendations together, they for a lot of people can improve sleep. If that alone is not enough, there are some medicines that can help. I think melatonin is a good thing to try. It has very low side effects. It's great for sleep onset, but may not keep people asleep if that's the issue. Trazodone and mirtazapine are some antidepressants that we've adopted to use for insomnia, and they tend to be fairly well tolerated, but just don't always work. And then the last thing that people are probably aware of is clonazepam or Klonopin or related drugs. They certainly work, there's no question, but they tend to worsen balance and potentially cognition. So we like to avoid them or use the lowest possible doses, and certainly try all those other things I mentioned before we get to them.
Great, thank you. And of course, my role as a physical therapist, I'm always ready to advocate for exercise to help with sleep and daily routines. Well, thank you, Dr. Barrett. I'm going to move on and ask a few questions to our participant, Diane. Diane, how did you find out about the clinical trials?
Well, when I first mentioned to my primary care doctor, she referred me to a local neurologist, and he did an MRI and determined that I had a neurological disease, but he wasn't sure which one at that point. And we asked him for a referral to somebody else so we could get a second opinion. And he referred us to UCSF, which is very highly regarded in this area and has a very good reputation. And they did extensive testing for me, cognitive testing, MRI, PET scan, and urinalysis and blood draw and various things, and testing my eyes to see if they could follow a cue. And so then they were the ones who told me about the clinical trial that was going to start, and they also were the ones who told me that I had PSP. So they were the ones that diagnosed that specific disease, and and so.
Okay.
That's great that you were able to find such a strong medical support system through UCSF and find those resources available to you. Could you explain what the application process was like to be a part of the trial? And did they cover your travel or other expenses?
Yes, they covered all the expenses. They did all the medical tests, and that didn't cost us a thing. And they reimbursed us for travel expenses.
Great.
I think the application
process. Information? Oh, I'm sorry, Doug. You go ahead.
Yeah, the application process was very time-consuming because the drug trial that Diane's in, 100% of the participants get the drug, so there's no placebo. So they spend a tremendous amount of time doing baseline testing so that they can establish, how you're doing versus the baseline. So she got an MRI, a PET scan, a lumbar puncture. She had extensive cognitive testing, looking vitals and things like that. And then their constant follow-up with that as well to compare that to the baseline to see how she's doing.
Great. On top of all of the things that are being tracked and monitored as part of your participation in the trial, do they send you home with any information or any requirements once you've enrolled?
They basically, after we started the clinical trial, they sent us home with a lot of medications. It's a 48-week trial, and we're about a quarter of the way through right now.
So we probably went up to San Francisco. We're about 80 miles away, but initially we probably had 4 to 5 visits up there. And now we go up every 12 weeks, and then we have a monthly Zoom follow-up.
Great, thank you. Now, Diane, this question comes from someone who said, I heard that it can be uncomfortable being in a CT or having other imaging completed. Should that stop someone from taking part in a research study?
I don't think so. The only part that was uncomfortable for me at all was the lumbar puncture, and everything else it was reasonably comfortable. And I just feel like it's an important thing to do because, first of all, there's hope that there's going to be a cure through this research. And I feel like there's so many things in my life that I can't do right now that it's very important to me to feel like I'm contributing in some way to society.
Great, and we thank you for your time and volunteering to be a part of such a clinical trial. What advice would you offer to someone who's considering taking part in a trial?
They have to be really committed to it because there's, you have to fill out a log about what time you take all the medications, and you have to remember it every day. And so Doug and I are pretty good about remembering that. And I sometimes have a caretaker, and she's good about remembering. She sets her cell phone to remember when to take the pills when she's here. And it's just, you have to be really committed because you have to be willing to get to the appointments and keep the appointments so everybody can know what's happening.
Mm-hmm.
Great, thank you. Now, you described some of the processes and the steps that it takes to be involved in a clinical trial and how that impacts your day-to-day routine. Has being diagnosed with PSP changed your life goals?
Yes, I feel very committed to doing the PSP, clinical trial first of all, and also making a contribution to following through with everything that I'm doing. And I have I write a lot of poetry, and so that's important to me. And I want to feel like I can make a contribution to my family. And I'm writing a book for them about family history and um, and just funny experiences major experiences that have happened to me in my life, and trying to put in a lot of funny instances there. And and we have 5 grandchildren, and I hope that this book is meaningful at some point to them, and um, and that they will learn a lot about me, and I want to be leaving something behind for them when I go at some point.
So our priorities change. We don't spend time worried about where we're going to go on vacation next year. We really focus on things that, Diane can do now, her writings, her poetry. She used to be an avid biker and hiker, and now she does the exercycle. But you find ways, how to make the best out of today in the short term and not really worry about long-term plans.
Great. I think that's a great, refreshing way to look at things, to focus on the here and now and the positives. And Diane, I think it's really interesting you speak about leaving a legacy, both to your family and as a participant in research. I have a question here that I'm often approached with during therapy sessions. Would you consider donating your brain to research? And
Yes,
how would
I
you
definitely would.
do that? Mhm. You would.
I definitely would consider that, and I've thought about it a lot and figure that that's one way I can make a contribution. And I want to be an inspiration to people, and I think trying to help in any way with research, if I'm able to do that, that's an important contribution I can make.
One thing we didn't mention earlier, but I think it's really critical, being part of a, clinical trial is great, but it also is part of a comprehensive plan that includes the physical therapy, sometimes occupational therapy, but to really stay on a whole program. So you can't just depend on one piece of it to work. It all has to come together.
Great. Thank you, Diane, and thank you, Doug. Diane, you've mentioned your poetry as being an outlet. I have a note here that you've written a poem titled PSP. Would you be willing to read that for us?
Yes, I certainly would. Progressive supranuclear palsy, the doctor said to me, it's a rare disease. It's also known by its nickname, PSP. You may have trouble walking. You may sometimes even fall. If you do, you may fall backward. You may bump against a wall. You may suffer some confusion by forgetting many things. You may feel you're disappearing by the sadness that it brings. It may affect your vision, changing how well you can see. Your hands may feel real shaky when you hold a cup of tea. You may find it hard to swallow when your tongue gets in the way. You may feel some deep frustration with your symptoms every day, but life can still be meaningful. Life can still be sweet. Feel joy where you can find it. Embrace life now, don't retreat.
Really beautiful. Thank you for sharing that, and thank you for fielding my questions regarding clinical trials and the importance they bring as we move forward. So thank you again, Diane. Thank you, Doug. Marty and Wanda, I have some questions for you as well. Marty, how did you learn that it was PSP and not Parkinson's disease or another neurodegenerative disease?
At first, the people I worked with that had Parkinson's, for symptoms were first symptoms were weakness in my legs, and I'd come home and I'd sit on the bed and watch TV. Then I started usually I come home and you were rejuvenated, but it turned out to be PSP. Well, my local doctor referred me to a neurologist, and went to the U of M. Harvard, they have their patient law with Mayo, because this is a rare thing. They have me see a neuroophthalmologist and scans, tests like this. And they came up with a PSP diagnosis.
So he was diagnosed 7 years ago by Dr. Tuitt at the University of Minnesota. And he wanted me to add that originally he was told he had 2 years to live. 6 months he would be in a wheelchair permanently. So going on hope, and big and loud therapy was very beneficial for him, an intensive program early on.
Now, this next question kind of builds upon that with therapies and the other aspects of a support network. How are you currently building your support network, and who is included in your network?
Primarily it's family and friends and colleagues. We even hired a caregiver And then now that I've been worse, we have hospice helping, and all of them are a major help. I wouldn't be able to be doing much of anything without Juan's help. It's very helpful.
So a lot of our support comes from friends, neighbors, family, and we had a caregiver early on for the first 4 years after his diagnosis, as I was still teaching. And now I'm home, but also he's receiving hospice care, which started last August. So the massage therapy, some physical therapy, massage therapy helps shoulder issue, and just it's very beneficial.
Now, Marty and Wanda, you told us a bit as we built up to this conference, some background regarding that painting. Could you maybe mention how that has been rewarding and its own support for you during this time?
I became friends with a lot of my volunteers who happened to be an artist and said, maybe you should try painting. I thought I really liked it. So I would advise people to try something new and think what you do to help others each day. We try to look at the positive thing, try to focus on things I can do, and art being one of them. One of the things I can't. Be optimistic and be kind. That's a nice feeling.
To Diane, your sentiment earlier, so focus on the positives and focus on each day as a little victory. Marty and Wanda, this next question kind of ties into planning. It reads, how did your diagnosis change, influence, or educate others? Or I'm sorry, how has that led to you changing, influencing, and educating others? And have you started to plan for the future financially?
Can I talk about this? So when we live in a small community, so when Marty was diagnosed as a family physician, and I was in the school system, and just because of it's a rural town, the news spreads quickly. So many people have no idea what PSP was. And we had a group of friends who got together and had t-shirts made. We have wristbands that say exterminate PSP. Fundraisers were held. Marty was driven through the local parade, and they handed out information sheets that were sent from CurePSP. So I think the whole community's been educated and following this path through the past years. Financially, do you want to explain that, Marty?
Yes.
Okay.
When we had a 401k, we had that at work. We already done it well, so we have well important. Well, one of the things that I learned about was the Bureau Trust, where you can have up to 30,000. Hopefully, it won't cost that much money around. But what's the Bureau Trust is for your cares, and then it can be touched by nursing homes. It can be touched by IRS. Anyone, the state. It's for Braille. You can be assured that it's taken care of.
And I don't know if now is the time to mention, but Marty has already gone through the process of the brain donation. We have filled out the documents, and that's all taken care of. So.
This is my brother's fellow doctor there. I glanced to brain biopsy and another brain donation. But when the MRI was done, and it showed my brain wasn't hollow.
Thank you, Wanda, and Diane and Doug as well. Now, Dr. Barrett, I'm going to spin this on you. There were a few questions submitted specifically to me as a physical therapist. Would you mind reading a few of these for us?
Sure. So the first is what treatments there are to improve balance. So what can you tell us about that?
Balance and falls are a common aspect of treatment for those living with PSP and other conditions. It's such a complex challenge because we need to figure out why the falls or why the imbalance is occurring. And there are many different reasons, but ultimately we often treat weaknesses through strength training and complex coordinated movements, such as different stepping sequences or quick changes in direction, or plyometrics as we might call them. And then the tricky part with balance are falls or imbalances occurring due to the environment or decision making. And sometimes, as you mentioned earlier, with cognition and mood disorder in these diagnoses, we can train that through things such as dual task training or the way we plan or sequence a task. So we might sort of break down a complex activity like walking into a kitchen and opening a refrigerator and train piece by piece to make someone more proficient and make better choices as they anticipate such a movement. So ultimately, this comes down to repetitious, high-intensity therapy, exercise, and a really good home exercise program.
Great. I think what I'm hearing there also is that it's so important to have a personalized approach depending on exactly what the person's problems are as it relates to balance. And given that there's not a great improvement with medicines like levodopa, although we always try them, it's nice to really be able to focus on some of these strategies you talk about. Are there any specific strategies that can help reduce falls?
Well, if we've hit the point where falls are occurring frequently, maybe we need to make environmental changes. And that's where meeting with a physical therapist or an occupational therapist can be helpful in determining the best assistive devices, such as specific walkers or even wheelchairs. Now, I find that this is a difficult discussion to have for some if it's initiated kind of off on the wrong foot. See, I may recommend a wheelchair for someone early because it positions them better posturally and for breathing and other aspects of living, that it then makes it easier for us to train balance exercises and walking exercises by not letting someone get into a bad position. So sometimes these devices are a means to an end, or sometimes we use them as an actual training tool. So it helps to meet with a skilled professional to help you determine, the best devices to help you in your day-to-day.
All right. I'm going to just based on this balance and falls, can you, I'm adding this in here, but just address freezing of gait and how you might, what are some strategies to deal with that specifically for people that have that issue? Maybe first just describe what that is, just if people aren't familiar.
Great. I think that's a good point to bring up. Freezing of gait might occur in these diagnoses where someone wants to start walking or start moving, and their feet may feel heavy or may feel stuck to the floor. And it's pretty common in different Parkinsonisms, and it's something I often address in my patients with PSP. Now, the way we can train or try to prevent those freezes from becoming falls or becoming more problematic, it's a lot of weight shifting based exercise. So it's impossible to take a step when all of your weight is distributed on both feet. We need to find a way to unweight one foot to step with it. We might achieve that through treadmill training or supported jumping type exercises when appropriate. And even if jumping and use of a treadmill or a harness system is not safe or feasible, there are plenty of other strategies in sitting, lying, or kneeling that do carry over to improved walking. So it does not require advanced technologies, as I've discussed in a previous Ask the Doc for CurePSP. We can do this through good old-fashioned physical exercise. However, if you have access to such technologies, sometimes that helps these patients who freeze safely be supported during training so that they can challenge themselves to shift beyond a comfortable limit. And that's where my interest in robotics and such lie. So the long and short answer is specific exercise to address the freezing, whether it's starting or continuing or turning, getting used to that stimulus, practicing how to get through it, and coming up with a number of different tools in your toolbox to help you get unstuck.
I think this was touched on earlier today, just the fact that diagnosis can be delayed, and sometimes it's a matter of getting to the right person. Maybe even beyond diagnosis, can you talk about what the benefit is in seeing a movement disorder neurologist and an interdisciplinary team that has experience with PSP?
Absolutely, and this is where some of the work done by the Patient and Care Partner Advocacy Committee and overall the CurePSP network really comes into play for these families in trying to locate these services. It is so important to meet with a therapy team and a medical team who are familiar with the diagnosis, not only to help make that diagnosis, but to help you medically manage things throughout the lifespan of the patient. So in my case, if I were to meet a patient who's not seen by a movement disorders neurologist, I recommend that as soon as I meet a patient with these diagnoses. Or if I suspect that diagnosis might be the case, I will suggest appropriately to be seen by such a specialist. So we want to get them the diagnosis and the resulting care team that comes with that movement disorders neurologist. So once they're seen by someone such as yourself at a CurePSP center of care, the patient and family can then interact with therapists who are familiar with evidence-based exercise to help with different aspects of disease, and other ancillary services, a good social worker or neuropsychologist who can address other aspects of living with these conditions. Because it is a rare disorder, and not everyone in the medical community is familiar with these things. So we will continue through CurePSP to lobby for education among patients, families, and ultimately clinical providers.
Yeah, I think you highlight what's important for PSP and other related conditions is that multiple providers and expertise are really needed. And if the better coordinated all those providers are, usually the better the care is, I think. So you've clearly dedicated yourself to the PSP patient and caregiver community. What about this work do you find so rewarding?
That's a good question, and I think that's a great way for me to sign off today as moderator of this panel, excuse me. Just as a patient and a family are going through the challenge of this diagnosis and what to expect, it is challenging as a provider, going up against a condition where we have yet to find a cure, but we do have our hope. I find such passion and purpose in providing opportunities in the here and now. How can we make a difference right here with our bare hands and some good old exercise or basic recommendations for how to live healthy, quality-based lives despite a diagnosis. So to Diane's point and Marty's point, focusing on what we can do well or setting short goals. And I mean, it is so rewarding to see patients, such as our volunteer yesterday, working with Dr. Hayden Smith and Dr. Stephanie Ross. We build these lifelong relationships with these patients, and though there are some difficult changes that may occur, it's an honor to be a part of that journey and to offer any glimmer of hope and any positive moment that we can, whether it's a joke within a session or prolonging the ability for someone to walk. It's definitely my life's work here, and I'm honored to be a part of that. So to our panelists actively living with these conditions and the families affected by them, we thank you in the community for letting us be a part of your journey. So thank you, Dr. Barrett, for fielding some of the questions my way. And again, it was an honor to meet you all, Diane, Doug, Marty, and Wanda. Thank you so much for your time and volunteering, not only with this panel, but everything that you give to your communities in regard to these diagnoses and overall advancing our mission. So thank you for being here with CurePSP and our speakers from VCU Health here in Richmond, Virginia. And please be sure to stay with us for the next session with another one of our peers, Dr. Claudia Testa, as she discusses telehealth or telemedicine, which has taken on a whole new role with the state of things in the last year during this global pandemic. And I'm really looking forward to hearing from a movement disorders neurologist perspective on how to provide quality care through the computer and over the phone. Now, these sessions will be made available on the CurePSP YouTube channel in a few weeks after they are edited for quality. You will be emailed when they are ready. However, the CurePSP YouTube channel currently has lots of other educational content available. If you'd like to reach out to myself or Dr. Barrett as medical providers associated with the CurePSP Center of Care, please feel free to email info@curepsp.org, and we'd be happy to field your questions. Thank you to all of you, and for those of you watching, it's been a pleasure to lead this panel. Have a great afternoon, and I look forward to seeing you at the next CurePSP event.